112. My name is Cody Long. I'll be your student nurse for today. I'll be performing a head-to-toe assessment. That is just checking to make sure that your body is functioning properly. Perform hand hygiene. Will you please state your name and date of birth?
Madeline and 42202.
Checking wristband to make sure it's correct. I'm going to ask you a few questions. Do you know what year it is?
2021.
Do you know who the president is?
Joe Biden.
And do you know where you're at?
Yes, level state.
Patient appears alert and oriented ×3. Patient appears her stated age. Patient's dress is well groomed. Patient appears in no sign of distress. Patient's gait was smooth and steady. Patient's mood is appropriate for the occasion. Patient's speech is concise, clear, and with no slurs. And patient's posture is erect. I'll be now performing vital signs. First, I'm going to do a pulse ox. I'm going to be assessing the patient's temperature. Patient's temperature is 98.6. Patient's pulse ox is 99. I'm going to be assessing the radial pulse. Patient's pulse is 72 and the respiratory rate is 16. I'll be now performing blood pressure. Patient's blood pressure is 130/80. Now I'll be assessing your skin, hair, and nails. Skin is consistent with ethnicity. There's no signs of jaundice or cyanosis, and there's no variation of color throughout. I'm going to now palpate. Skin is warm, temperature is equal bilaterally. It is smooth and dry. All right, now I'll be assessing skin turgor. Skin returns to original position. I'll be palpating the scalp. Hair is evenly distributed. Hair color is brunette. The scalp, it is dry, has no lumps or lesions, and is symmetrical. Now I'll be assessing the nails. Nails are firm, convex, clean, at a 160-degree angle. I'll now be assessing your head and neck. The patient's head is rounded and symmetrical. The patient's head is erect and midline and proportionate to the body. I'm now be assessing the patient's facial features. The patient's facial features is the expressions are appropriate for the situation. There's no lesions, and the features and movement are symmetrical. The trachea is midline to the body. There's no lumps or lesions and no obvious goiter. Now I'll be palpating the sinuses. Please let me know if there's any tenderness or pain.
No tenderness or pain.
Okay. Now I'll be palpating the TMJ. Please open and close twice. Is there any tenderness or pain? Alright, the TMJ moves smooth. It was symmetrical on both sides. There's no crepitus, clicking of the jaw. I will now be assessing your eyes. You can start with the corneal light reflex. Please look straight ahead and follow the pin light to the bridge of your nose.
I will now be assessing your abdomen. The abdomen is
Corneal light reflex appeared the same in both positions of both the eyes. Alright, I will now be assessing your furlough. Please look straight ahead. I'm going to shine a light to your eyes.
I'm going to auscultate her brow surface.
Pupil are equal, round, reactive to both light and accommodation. Alright, now I'll be assessing your sclera and your conjunctiva. Please look straight ahead, or please look up. I'm going to pull your eyelids down. Sclera is white and shiny, and conjunctiva is pink and moist with few blood vessels under the eyes. Now we'll be doing the Snellen test. Will you please stand over here? You cover one eye. Now point at the line for you to read off the best you can. Read off the best that you can see.
FELOPZD DEFPOTEC.
Okay, left eye is 20/20. Will you please cover your other eye?
FELOPZD DEFPOTEC.
Right eye is 20/20. Will you use both eyes now?
FELOPZD DEFPOTEC.
Both eyes are 20/20. I will now be inspecting your ears. I'm going to start with a whisper test. I'm going to stand behind you and whisper in your ear, and please repeat the words I say back.
Cat. Dog.
Patient can hear sounds equally in both ears. I'm now going to inspect the outer ear canal. Patient's ears at attachment are 10 degrees from vertical. I'm now going to palpate the ears. Patient's ears are pliable with no lesions and are smooth. I'm now going to inspect the inner ear canal by pulling back the ear and looking in here with my pen light. I don't have an otoscope, but I would use that right now if I did. Patient's inner ear is light in color. There's little yellow serema, and the tympanic membrane is shiny and gray. I will now be assessing your nose. Nose is midline symmetrical with no flaring or discharge. I will now be assessing your mucous membrane. Mucous membrane is pink and moist with no lesions present. I'm now going to palpate. Please let me know if you feel any tenderness or pain. Patient states no tenderness or pain. I will now be checking the patient's nose patency. Please cover one nostril and breathe in and out. Please cover the other one. Patient's nose patency is clear, and the patient breathes freely through both nostrils. I will now be assessing your mouth. The lips are midline and symmetrical, moist and pink with no lesions present. Will you please open your mouth and say ah? Patient's mucous membrane is pink and moist with no lesions present. The uvula rises and falls symmetrically with after vocalization. The tonsils are small, pink with no lesions present and are symmetrical. The tongue is rough in texture. Color is consistent with ethnicity, and it has full mobility. There are 28 teeth in the patient's mouth, and they are in good repair. I will now be assessing your cardiovascular system. Patient appears in no sign of distress. I will now be palpating your skin. Skin temperature is warm with no signs of edema. I will now be checking the capillary refill. Capillary refill is within 3 seconds. I cannot check the capillary refill of the patient's toes because he has on nail polish and the nail bed was 160 degrees. I will now be checking the peripheral pulses. Temporal, carotid, radial, dorsal pedis. Patient's peripheral pulses was +2 and equal bilaterally. I will now be palpating for heart sounds. This is aortic, pulmonic. I would now auscultate the herbs and tricuspid. I I will now auscultate the mitral and apical. The S1 and S2 was heard clearly and audible with no extra sounds or murmurs, and the aortic rhythm was smooth and consistent. I will now be performing a pulmonary assessment. Patient's posture is erect. Chest movement rises and falls symmetrically with no labored breathing on inspiration and expiration. There is no other muscles used to help aid in breath sounds. We now go into the spine. Patient's spine is midline, symmetrical, and with no abnormalities. We now come to the front. Patient side-to-side movements are symmetrical. I will now be palpating to check for tenderness. Is there any tenderness? Patient states no tenderness over anterior and posterior regions. I will now be doing it's a tactile firmness. I'm gonna put my hands on your back and say 99.
99.
Please say 99.
99.
Tactile firmness is equal bilaterally on posterior and anterior. I will now be doing a chest excursion. Please breathe in. Patient's chest excursion is equal bilaterally and rises and falls symmetrically. I will now be doing percussion. Percussion note is resonant through all lung fields, posterior and anteriorly. I will now be doing a auscultation. Please breathe in every time I press the stethoscope to your back. Vesicular lung sounds are heard anterior and posteriorly over all lung fields. I will now be assessing the patient's abdomen. The abdomen is flat, slightly rounded on edges, symmetrical, with no distensions or masses present. There's pulsation. The apical pulsation is seen. I will now auscultate for bowel sounds. Bowel sounds are heard every 5 to 15 seconds. Second bowel sound is audible. It is heard in every quadrant, and there's no bruits present. I will now be percussing the abdomen. Tympany is heard over all 4 quadrants. I will now be palpating the abdomen. Please tell me if you feel any tenderness. Patient states no tenderness, and there is no masses present. If I was to palpate further, I will be palpating for the spleen and liver, and spleen and liver should not be palpable. If so, abnormalities are present. I will now be assessing the musculoskeletal. Patient's posture is erect. Patient's hands and feet are symmetrical bilaterally in shape and size. Patient's scapula and shoulders are symmetrical. I will now be performing a strength test. On the bicep, tricep, trapezius, I'm going to place my hand on your bicep, please pull up. Place my hand on your tricep, please push down. Place my hand on your bicep, please pull up. Place my hand on your tricep, please push down. Place both hands on the shoulders, please shrug. Patient has active range of motion against full resistance. I will now be performing range of motion. I'll start with the fingers, do abduction, adduction, flexion, extension, hyperextension. I'll now be doing the wrist, do flexion, extension, hyperextension, supination, pronation. Now I'll be doing the elbows, flexion, extension. Now I'll be doing the shoulders, abduction, adduction, circumduction. Be doing the neck, do flexion, extension, hyperextension, right rotation, left lateral extension, right lateral extension. I will now be doing the spine, do flexion, extension, hyperextension. I'll now be doing the hips, do abduction, adduction, flexion, extension, hyperextension, internal rotation, external rotation. I'll be doing the knees, flexion, extension, and I'll be doing the ankles, do eversion, inversion, flexion, extension, hyperextension. I will now be doing the toes. Take my sock off for this. I will now be doing, all right, let's see, you do flexion, extension, hyperextension, and then do abduction, which is out, and adduction, which is in. I will now be performing a neurological assessment. I'll start with the optic nerves, name and number. 1 is olfactory, 2 is optic, 3 is oculomotor, 4 is trochlear, 5 is trigeminal, 6 is abducent, 7 is facial, 8 is acoustic, 9 is glossopharyngeal, 10 is vagus, 11 is spinal accessory, and 12 is hypoglossal. I'll now be performing the Romberg test. Please stand up, put your arms by your side. Please close your eyes. Patient maintains balance with minimal sway. We'll now be performing a sensation test. Please close or turn your head away from me and tell me if you feel sharpness or dullness.
Dull. Sharp.
Patient sensations are intact. I'll now be performing a graphesthesia test. Please close your eyes.
A. B.
Patient was able to state the letters I draw in their hand, so patient's graphesthesia test is equal bilateral. And I will now be performing a patellar reflex test, or percussing the patella. Patellar reflex is intact, +2 bilaterally. I will now be performing a Brudzinski test. Please lay back, fully relax, and I will lift your head past range of motion. Patient's Brudzinski test is negative because the patient's hips, knees, and legs did not contract involuntarily.